Unit 4. So Unit 4 is divided into two chapters, lung value and lung capacity, and another one is urinary system. So lung value and lung capacity. So here is the instrument spirometer. Spirometer is the instrument which we are using to determine the lung capacity, whether the lungs are working healthy or not, in normal values or not. Okay. So spirometer we are having in the lab. So lung value, first one is tidal value. So tidal value is defined as, so the amount of the air present during normal inhalation and exhalation is called tidal value. Say at rest. So inhalation and exhalation. At rest. So it is normally 500 ml in both male as well as female. Okay. So what is this ml? So when we use this spirometer, it is the instrument so which we are using. So we are filled up with water. Okay. Then there is a drum and indicator. So when we inhale the breath and we will blow, so it will go up and down, depend upon the how much force we are applying to this tube. So it will indicate it. So during normal respiration, at rest, if you blow slowly, so it will give the indication to 500 ml. Okay. So next is IRV. Inhalatory reserve value. So inhalatory reserve value. So it is above the tidal value. When we apply the force in inhalation, we are taking the breath with forceful inhalation. So in male it is 3000 ml. Whereas in female it is 1700 ml. So in male and female it will differ. Okay. Next is ERV. So expiratory reserve value. So expiratory reserve value compared to inhalation it is less. Okay. So when we are inhaling, we will take more amount of the air compared to exhalation. So exhalation in male as well as female, it is 200 ml in male and female it is 700 ml in female. Okay. Then vital capacity. So vital capacity means what is the lung capacity? It includes IRV plus VRV plus tidal value. The total of these three indicating vital capacity. Okay. So IRV, say for male, what is the IRV? Inspiratory reserve value? How much? 3100 ml. 3100 plus ERV 1200 plus tidal value 500. So total you calculate with the help of your mobile. So 3100 plus 1200 plus 500.
4,800. 4,800.
4,800 ml is the vital capacity. Okay. But same formula in females. So what is the IRE? Inspiratory reserve value? 1700 ml. Plus ERE? Expiratory reserve value? Expiratory reserve value how much? 700. Plus vital value? 500. How much?
2,900.
2,900
900.
ml. So in female, the vital capacity is 2,900 ml. Okay. So similarly, total lung capacity. So total lung capacity, it is the sum of vital capacity plus it will come residual lung value. Total lung capacity and total residual lung value. So even after inhalation, exhalation, some amount of the air is still present in our lungs. That is called residual lung value. So that is 800 ml. So here 4,200 are available. So 4,800 is vital capacity. This residual value is 1200 ml. So total it is 6000 ml. Total lung capacity is residual value plus vital capacity. So similarly in female, how much? 2,900 ml plus 1200. So it is 1100 in female. The residual value in female lungs is 1100 ml. So 2,900 plus 1100. How much? 4,000 ml. Total lung capacity in females it is 4,000 ml. Total lung capacity in males is 6,000 ml. So this question sometimes they will ask. So remember. So artificial. When normally we are unable to take the respiration, we will take the artificial respiration. So or the patient or subject who is unable to take the normal breathing, then we will use this artificial respiration. So we will give the breathe to the subject. So when this will require, number one, electrical shock. Say due to rainy season or else you are doing own repairs to the current, then if it is producing shock, at that time the subject may not take the normal respiration. Or else carbon monoxide poisoning. So if the environment is filled with carbon monoxide, so in these conditions we require artificial respiration. Or else carbon dioxide poisoning. So where we require artificial respiration. Sometimes accident. So the patient unable to take the respiration. Then we are using this artificial respiration. Okay, in this artificial respiration, what are the precautions need to be taken? So first we should identify whether the pulse is working but it is very weak and heartbeat is present. So we should keep the patient subject. So we should keep the subject in prone position. The body should be in prone position. And then the melena okay. So then the collar, the shoulder, the bottom should be removed and make the neck area in relaxed position. Okay? ఇక్కడ ఏమైనా గట్టిగా కట్టి ఉంటే ఏమంటే రిలాక్స్. Okay. So then if any amount of and air open. So the subject should be keep in the where the air is available, the flow of air is available. Not should be in congested room where the air is not available. The patient should not feel the suffocation. Okay. So gaali baga tagile place lo the open place lo. Okay. So then any mucus or unwanted particles, so we should remove with the help of tissue paper. But in unconscious level, పడిపోయిండు ఆ నోట్లో ఇది చెత్త చెత్త మ్యూకస్ ఏదో ఉంటే టిష్యూ పేపర్ పెట్టి. ఓకే. So then we should do this process of the person who is doing is called resuscitator, like facilitator, resuscitator. Okay. So we should kneel down in front of patient at the level of chest, beside the shoulder. Okay. We should kneel down. Then we should keep the patient as the procedure described, prone position, then in a relaxed condition where the air is available, and we should lift the chin. Okay, and we should open the lower chin with the help of thumb finger. We should observe the tongue should not be folded inside. If we blow, the tongue may be obstruction in the flow of the air. That is leads to choking. And మనము వాడే దవడ కిందికి కానీ ఏమన్నా మ్యూకస్ అవన్నీ టిష్యూ పేపర్తో క్లీన్ చేయాలి. తర్వాత ఏంటి ఆ నాలుక అంటే కొంతమంది లోపలికి మాట్లాడే లోపల ఉంటుంది. అట్లా కాకుండా నాలుక కూడా బయటికి ఓపెన్ ఉండేటట్టుగా చూడాలి. ఓపెన్ కలిగితే ఫింగర్తో క్లీన్ ఫింగర్తో నాలుకను బయటకు వచ్చేటట్టు చూసుకోవాలి. ఎందుకంటే మనం గాలి ఊపితే ఆ నాలుక అనేది అడ్డుకోవడానికి ఉండదు. ఓకే. సో ఇప్పుడు పడకబెట్టి అన్ని చేసినట్టు ఇప్పుడు ఏం చేయాలి? విత్ ద హెల్ప్ ఆఫ్ లెఫ్ట్ హ్యాండ్, thumb finger and index finger, we should close the nostrils and the chin should be open, the tongue should be open. Then you will take the deep inhalation, the resuscitator, and blow into the mouth of the subject. One note of Buddha. Okay. So how many times we should blow? Around 12 to 14 times per minute. So ప్రతి నిమిషానికి ఎన్నిసార్లు మన నోట్లో నోట్ పెట్టుకోవాలా? 12 to 14 times per minute. So అది ఎంతసేపు చేయాలా? Still the subject will get normal. Okay. This is called artificial respiration.